of this disease and nature of this situation that, we are faced with.
Can I ask a Simon? Oh, no, it's fine, sorry.
Is it a follow-up question?
Sort of. I'm afraid I don't think you sufficiently answered Richard's question, but I do have a question about if you are saying that you did the best that you could in the extremely difficult situation that you had, and that the isolation was more or less effective given the circumstances, I wonder why you didn't put the people in isolation right at the moment that you learned that there had been an infected passenger. You waited 72 hours before putting them into isolation. Can you explain why you did that?
Well, actually, your question is very important. But, this one, ship is owned by US
US company.
and also UK is legally, then all of a sudden, Japanese authority have to deal with this situation. And I understand the 13th of February is the date the captain was alerted, right?
February 3.
February, sorry. February 3 is the date that captain is not the Japanese official, Then what you're saying is that the 1 day gap, right? You have 2 day gap between 3rd and 5th. That's what.
Yes, but the Japanese authorities learned on February 2nd.
Well, that one, actually, I'm not in a position to answer that question. So this one, to be frank, technically, I'm not in the position to answer that question, to be frank.
Yeah, as a medical officer in Japanese Ministry of Health, I cannot tell exactly what's the reason why they need to take around 72 hours to decide to start the quarantine. But I heard that at the first stage they need to negotiate with the company itself and the captain. So they need to negotiate. And as for the operation, sometimes they need to go away from the shore because they need to clean up their water. So sometimes they need to arrange the operation itself. So I heard that's the reason. That's one of the reasons why they need to take the around 72 hours. Something.
Can you please repeat what you said before? Because
okay, yeah. As a medical officer of Japanese Ministry of Health and Labor and Welfare, I cannot say exact reason. I'm not sure. What's the exact reason of they need to take 72 hours before their isolation starts. But I heard that they need to negotiate with the captain and also the cruise company, and they need to arrange the operation itself because sometimes they need to go away from the seashore to clean up their water or something like that. So at the first stage, they need to arrange the operation itself. I heard.
So what did the captain and the cruise company do? Sorry. What did the captain and the cruise company do to delay or impede a hasty imposition of quarantine? You said that they had to negotiate, which suggests there were different positions and common ground that had to be found. I'm surprised by that. I'd have thought a captain would readily accede to whatever the quarantine authorities proposed.
I didn't have exact information on that topic, so I need to check up with that.
Well, as he said, that there are a lot of lead time they needed because this is unexpected situation. To be frank, Then, as I'm sure you agree, you are aware that there are no established so-called international agreement as to who, how, to respond to this kind of the situation. So captain is a captain. Captain is not health expert. Captain is not hospital manager, and he's not under Japanese the line of authority. There are lots of negotiation, and it belongs to U.S. and Japanese government has to do. So those are lack of absence of the international agreement official is one factor.
But could you answer Richard's question, which was what were
Sorry.
the actual objections?
Would you raise your hand when you have a question?
Go ahead, sorry, Simon is.
Okay. So just one comment first of all. You showed us this chart a week ago with 168 people. You now have 199 people on it. But just for talking about common sense, it stands to reason, I think, that if you take the first 199 people out of 700 people, you could come to a very different conclusion about when the infection was onset. So forgive me if I'm not convinced by this until you get data from 700 people. We spoke about this last week, and you said you were looking into getting, you were analysing the data. So I'll look forward to that. I'll stay unconvinced, I'm afraid, until we get more data. But can I ask two questions? That was just a comment, but I want to ask two questions. One concerns the crew. I mean, this chart does show that not a single member of the crew had symptoms on the 5th of February. Now we have 105 members of the crew. At least, I don't know what the latest number is. Maybe you can tell me. I think it's probably more than that. It's probably 120. But perhaps you can tell me what the latest number of the crew is. Implying that 100 or more members of the crew were infected after the quarantine period. Now, those crew members publicly appealed to be let off the ship, to be released from what they considered to be captivity. So, do the crew not have human rights? Because you talked about human rights, and they're very important, but the crew members felt they had no human rights, and their human rights were ignored in this situation. And my second question relates to officials who worked on the ship. We know that Dr. Kentaro Owata made some criticisms, but my question is, 6 people who worked on or around the ship have fallen sick that I know of: ambulance driver, medical staff, 4 government officials, people from the health ministry itself. So what justification is there for not testing all of those people and quarantining all of those people the moment they stop working on the ship? I understand some tests belatedly have been ordered, but not for the medical staff. So how can you justify allowing people to go back to work in the health ministry, to go back to work in hospitals around the country where they're dealing with sick patients, where they've been on this ship, where we know that people who are working on this ship are catching the virus, because at least 6 people have caught the virus, and then you're putting them into medical centres around the country where they're potentially dealing with people who are ill, with elderly people. This seems to me to be a huge risk. So there's 2 points. One is the crew and one is the officials. Thank you.
So as for the PCR testing for the staff who worked on the ship is really important question. And actually, basically, we need to prioritize staff who needs testing. So theoretically, the medical officer and also the medical staff needs to be tested. But we first prioritize staff who will work as an official. But I think now we discussing, who should be the second batch to be tested. So as you mentioned that the medical officer needs to work in the hospital after they work on the ship, and also as for the medical officer in the Ministry of Health needs to work after their duty on the ship. So we are now discussing on the who should be the second batch. In my opinion, that medical officer and also the medical staff should be the second batch.
I mean, should they be quarantined? Should they be quarantined until they're tested?
Uh,
Sorry. Yeah, should they be quarantined until they're tested?
Yeah, if they got fever, they have onset, practically, all of them who has the fever or the symptoms has, doing their work by, teleworking now. So, but officially, we didn't reach the conclusion yet, about the criteria for our staff itself. But we need to, set up some kind of criteria, for working after the duty on the ship. That is ongoing discussion.
Well, the crew member, as I said, this crew member is all crew sort of event, so-called. I'm sure that you are approaching to the end, right? Not yet the end, but still there are, some lingering negative impact from this. So that I agree. But as I said, this the situation in the cruise ship is also sort of the understand within the context of overall our response policy. These are in tandem. Of course, as I said, the level of the infection density is higher than the community, but it's a continuation. That's why we cannot singly rule out this one, deal with this one in isolation from the overall national policy. That's why gentlemen may get infected, but our policy and the community it is just impossible to suspect everybody in the quarantine. If you go to like a restaurant or a karaoke bar, there you may be infected. Then you have to put everybody in the quarantine for 2 weeks. It's just impossible. That's why our policy, in terms of the community prevention policy, is if they show the symptom which lasts 4 days, that's the time, they are requested to report to the health authority for advice, except those people who are elderly and vulnerable, that 2 days. Then also coming back to this, those people who disembark from this cruise is as soon as, right? So that's how we, the modify the approach tailored to this, the risk of the infection. So that in that sense, the cruise ship member, as we repeatedly said, that there are some cases, some passenger people who got infected after this, and obviously crew members were quite at risk because majority of passengers was put in a single room, but crew members have to share the room, and they have to serve the passengers day and night. Oh, they are put in a very, very difficult situation. And sometimes, as I said, they must have shared the room. So, on the human right, of course, we sympathize, but as far as the passengers are still there, they have to provide the service. So this is a dilemma. This is a dilemma that we have, and we all Japanese, I'm sure that the non-Japanese as well, we are very grateful to those crew members who worked very hard. Sometimes at the expense of the infection in a way. We are very grateful to them. Or passengers also. Passengers, had a hard time because of their sort of a sense of the spirit, cooperation to prevent this virus from entering the country, right? So we are all grateful, passengers, crew members, and also medical quarantine officers. So it's everybody, put into the very difficult situation. That's a point I like to make it very clear. So crew members, human right, of course they have a human right, but because of the need to provide a service to the passengers, they stay. That's the reality. You see, that they are put into, we are very grateful.
Robin Harding from the Financial Times. Just to come back to the decision to release passengers from the ship after quarantine. The US thinks these people need another 2 weeks of quarantine. Hong Kong thinks they need another 2 weeks of quarantine. Australia thinks they need another 2 weeks of quarantine. Canada thinks they need another 2 weeks of quarantine. The UK thinks they need another 2 weeks of quarantine. Only Japan doesn't think they need another 2 weeks of quarantine. Could you explain why all those other countries are wrong? And could you also explain who will take responsibility if any of the people who were let off the ship in Japan infect someone else? Thank you.
Well, as I said, you are right, and there's a risk. You are right. Passengers who disembark and they go back to the home, and for this is self precaution, right? Not in a quarantine. They may develop a disease. That's why I think the Japanese government policy, as I said, should be consistent with the national community prevention control policy, as I said. So this should be.
So Japan's policy is not to isolate people who have been exposed to high risk of the coronavirus.
Oh, that's why our policy, as far as the